Thank you very much for the invite, Marilyn. Big honour to be able to speak with some of the amazing, we'll be speaking alongside some of the amazing speakers we've got here. So I'm quite new to working with patients in CMT. Yeah, it's an area that I think exercise is a really important part, and Josh has already spoken about that. And physios and exercise, we sort of go hand in hand. So I think that's why we're quite an important cog in, I suppose, the treatment planning and keeping everyone moving as much as possible. So most of my working is with healthy population. So, but yeah, I think that interest in CMT has come about because of the potential benefit that we really see with setting up good treatment plans and good exercise programs to allow patients to improve over a period of time. So to start with, we'll just go through a quick neuroscience crash course. So we've got the nucleus, so this is the cell sort of in the brain, for instance, and when we're trying to do a muscle contraction, for instance, so say you want to get your bicep to turn on and go like this, we send a message from that nucleus along the axon to the muscle, and then the muscle contracts, okay? And then the axon is like the long sort of connection, I suppose, between the brain and the muscle that we want to contract. We've also got the myelin sheath, which are the little, sort of like helps the conduction, sort of turns an old country road into a freeway, basically, and helps the message get along nice and quick. So the message can go from the brain down to the muscle, but it can also go back up the other way. So sensation and so temperature, pain, all get sent back up towards the brain. So we need that sort of two-way communication. So the effect of CMT on the muscle, so length-dependent reduction in muscle strength. So meaning the further away or further the distance is that the nerve impulse has to travel, the more chance there is going to be of reduction in strength and muscle size. So that's why it's down at the feet, because the message has to go from here all the way down to here. So there's more chance of having an interruption on that impulse as it goes through. So we get that decrease in muscle size of the affected muscle. So you can see here, obviously, quite small calves, and we get those changes in foot position. So we get that slower transmission of the nerve impulse along the nerve. And a lot of this should be sort of common knowledge, I would imagine, in this room. So exercise. So with exercise, like I heard a quote recently saying that if we could put exercise in a pill, every single doctor would be prescribing it, every single patient would be taking it. So it's maybe not as sexy as the drugs and stuff like that, but it's something that I think, yeah, if it was in medication, everyone would be taking a lot of it. So what type of exercise is beneficial for CMT? So Hereditary Neuropathy Foundation, they recommend low impact aerobic exercise, so bike, walking, maybe a bit of rower, things that aren't getting your heart rate up too much. Then the resistance exercise, so Josh touched on that. And then Tai Chi, so nice slow movements, working on balance and strength. Yoga for a bit of flexibility. And they don't recommend high impact sport, so things where your foot's leaving the ground and we get that impact of the foot. Because that sort of reduction in balance, there's more chance of injury, so ankle sprains and broken bones and things like that. So it's not recommended, doesn't mean you can't, but yeah, if we go sort of more with the ones at the top. So what is the effect of resistance exercise on the body? So this is in a healthy population, so we get increased strength, we get increased muscle size, we get improved neural input to the muscle, so the brain becomes more efficient at sending the messages to the muscle. You get improved mood, self-esteem, confidence, and cognitive function. So a lot of the stuff that we see exercise, a lot of what we see the effect of exercise is actually the opposite of what happens with CMT. So we get reduction in strength in CMT, we get reduction in muscle size, we get decreased neural input to the muscles. So if we add exercise in, it's doing exactly the opposite to what CMT is doing to the body. So it makes sense to have that as one of the mainstays of treatment. So just to reinforce Josh's amazing study, I think this has been, this was one of the most recent articles I could find on strength training in CMT. So that targeted training, so he's focused on one particular muscle group, being the muscles that live on the front here that lift the foot up. Moderate intensity, so when we say moderate intensity, if we were to say 100% intensity, that is the maximum amount of weight that you can lift with one repetition. So Josh had people working at 50% of that, up to 70% over the time of the study. Also had progressive resistance training, so meaning it wasn't just the same weight from the start of the study to the end. They made it harder as the patients got stronger. So as Josh mentioned, we got that 5% improvement in strength over the 2-year period compared to a 24% decrease, so that 31% increase all up. And the peak improvement, and Josh could probably comment on this too, is that neurogenesis, they were saying, was potentially the cause for why the benefit would be a little bit longer than what the study length was, so out to say 9 months of resistance exercise, because of that neurogenesis, which is that regeneration of nerves, which studies have shown that it can be 1 millimetre can regenerate every day. So it ends up, if you imagine going from, say, your hips all the way down to your feet, there's a lot of millimetres there. So they do take time to regenerate. So you can't just do exercise for 4 weeks and think, yeah, I'm strong now. You need to stick with it over a period of time to get that sustained benefit. And yeah, potentially it takes a bit longer in CMT to get to the stage where you are able to say, yep, I'm actually a bit stronger now. But yeah, I think that consistency with it is the key. So here's just an example of if you were to work out what that 1 rep max would be. So Josh was working people at a level of 50 to 70%. So that means the maximum amount of repetitions they could do was 30 for 50%. And if you do the percentage calculation of a 70% 1RM, that's sort of 12 to 13 repetitions, just to give you an idea of sort of how many times before you get so tired you can't actually do the exercise. So I think consistency is the key. So the best exercise program is one that you can stick to. Okay, there's no point having the best program out there, best exercises, best equipment if you don't get it done. So it needs to be something that you enjoy. It needs to be something that you can do with people that you enjoy exercising with, and you also want to have someone that you're accountable to. So is that just to yourself? Is it to your partner? Is it to your physio? Is it to your GP? Who is it that is keeping you on track? Because it's hard to stick with exercise, even in a healthy population. Like, otherwise everyone would be, the perfect weight. We'd all be walking around looking like bodybuilders, but it's not like that. We need to be able to stick with it because humans aren't great at change. So find out what works best for you. So if we move to balance now, so there's a couple of different systems that work to help us balance. We've got the vestibular system, so in your ear we've got little canals with fluid in them, and they help to tell us if our body's sort of slightly to the side or if we're twisting. We've also got proprioception, so this uses the nerves. So if I feel contact on the outside of my foot, it's sending a message up to my brain to say there's more weight on the outside of your foot, so you better correct it because you might keep going that way. Okay. So proprioception is what gets affected in CMT because we don't get as many of those messages from the skin and the ligaments and the bones and the muscles in the foot back up to the brain to tell us are we off balance or not. Now with balance we have 3 strategies. There are 3 ways that we stay on our feet. We've got our ankle strategy. So this is the most efficient. So that's when you take a step, you land on a little bump, your foot goes a little bit to the side and you correct yourself and you keep walking. End of story. So the ankle does a lot of that because it's so close to the ground. It can adjust your body position so that you don't fall over. If the ankle can't do it, or you go past the stage where it's too much force to be able to correct from the ankle, the hip gets involved, and that's where we start to see the sort of bottom stick out, or you go to the side like this, or when you see someone walking with wide legs because they're a bit wobbly, they are trying to make a bigger base of support so their hips can work a bit easier. Then we have the step strategy. So this is when you get knocked and you have to catch yourself with a quick step. So that has to be a quick movement. And with CMT, we see that ankle strategy is one that isn't as well utilised. So people will tend to rely a bit more on the muscles further up the chain, like your glutes and your quads and your hammies. So they'll tend to use a bit more of the hip strategy. So we can improve our balance from working on the strength around this sort of trunk region, hips, core. So that's sort of why that strength in that region is so important. The stepping strategy is a bit more, you need that sort of speed to do that and nice strong legs. So we'll go through that in a sec. So CMT, as I said, we get that damage to the nerves that travels down into the foot. We get the foot drop occasionally where you can't pick the toes up, so you're more likely to scuff your toes, more likely to have a fall. And then we get the foot contractures where the joints in the foot don't move as well as they once did. And the foot adopts these different postures like the really high arch or the really flat foot. And again, that makes it harder to use that ankle strategy to be able to balance and keep us upright. We've also got falls and the fear of falling. So there's a bit of a cycle with falling. You'll tend to, if you have a bit of a tumble, then you might be more, I suppose, a bit more worried about going along that same path, and you might avoid situations where you feel like you might get a bit wobbly and might fall. So we then, if we don't challenge our balance, then we tend to get worse with our balance, and then we're more likely to fall. So it just goes round and round in circles. So we need to try and train balance to stop ourselves from getting worse as we get older. So important to not just avoid the unstable situations. We need to try and do them in a safe environment so that you can get better at them. So I thought I'd just put together a few exercises that would be good at home. So with this, all you need is a chair and a TheraBand, so a stretchy resistance band. Takes about 10-15 minutes to complete, and it's only got 4 exercises. So this is the one I'll borrow Marilyn for. Could I borrow you, Marilyn? So when you get Marilyn up on here, and very carefully using her balance to get up. So this exercise is similar to the one that Josh had in his study. He used a sort of weights on a, would you call it a sock or a sort of a bit of a cuff, on the foot that they used. This is a nice easy one that, if you want to sit up on that. Nice easy one that you can get, you can get these at sports stores, or any physio place would have these. So with this one, we're using different coloured bands to make it a bit harder, and this strengthens the muscle here. So this is the one that stops your foot dropping and helps you to lift your toes up as you take your step. So I'll just get Marilyn to demonstrate. So if you actually push up back a little bit here, this way. So we get the band, like that. We get the bands. So you can tie this around like a table leg or a chair or a door handle or something like that. It's going to wrap around the foot. I'll be the door handle for now. And Marilyn's going to pull back against the band as hard as she can. That's good. Look at that, with facial expressions and everything. Yeah, good. Slowly come back down. So she's trying to keep it all in one line. She's not letting her foot drop in towards the side or go out towards the other side. Pulling up again. Can you feel the muscle working through the front there? Yep. So this is a red band, so we consider this a light resistance. If we go a bit more hardcore, we'll get a black band for Marilyn now. So if you try and pull back against this one, it's going to be a bit more challenging, this one. This one's getting a bit more towards her 1 rep max, I would say, and then coming back down.
Slowly.
Yeah, slowly. Slowly is better, and then going up again. So 3 sets of 8 to 12. So when I say 8 to 12, it means you aim for 12, but if you don't get to 12, that's okay. So the first set might be 12, second set would be 12, third set might be sort of 8 to 10. But you want to get to that fatigue state. So just skip through this. Then we've got the calf raise if you want to have a stand up. So just rising up onto the toes with this one. Got a few different options. We can either do the opposite to what we just did, holding the band and pushing the band away with your toes. Or we can do a seated calf raise, which some of you might be able to see me do this, but just rising up onto my toes in sitting, and then we can put more weight on it to make it harder. Or we can do the one that Marilyn's going to try, so doing a calf raise in standing. Yeah, it's as high as you feel comfortable to, and then coming back down. This is one Marilyn's done before, expert at it. And then if we were to be really mean, we'd make her do it on one leg. So that's a little bit more of a step up. I don't know if would you be up to a single leg version? Yeah, of course. Good, so you can see she can just get up a little bit there. So that works the calf muscle at the back here. Again, one of the ones that tends to get affected in CMT. You can add weights if you want to be even meaner again. Then we've got single leg balance. So usually good to do this in the corner of a wall. So you've got a fingertip on each wall. We've got a few different options there. So level 1 would be Marilyn trying to stand with her feet together. So ankles touching and then not holding on. So she's trying to do 3 lots of 30 seconds. So you'll get a little bit of that wobble. And you can see a bit of ankle strategy, a bit of hip strategy, hopefully no step strategy. And then level 2 would be standing heel toe. So going heel and toe, trying to balance in that position. Again, trying not to hold on.
David laughing, continue doing this at night.
Yeah. So again, this is one that Marilyn's done. Try to. And then, further steps on would be a single leg version. Again, you've got the wall there to balance if you need. Or standing on a pillow. Like Josh mentioned, there was some of the kids were trying standing on foam on a beam and things like that. So you can really push it, and depends on where the person's at. If they're really affected, you're going to start way down sort of on the lower level, and then if it's they're mildly affected, then you can push them fairly hard. But you do want to get to the stage where you almost lose your balance, because if we stand there and it's really easy, then you're not challenging your balance, so you're not necessarily going to get better with it. So you want to try and work it to the stage where you do get a bit wobbly. And sit to stand. If you want to have a, do you want to come down that way? Yeah, right. Good job. So we'll do it on the stage. So sit to stand. So this works the glutes, quads, hammies, a bit of core as well. So Marilyn's going to try and stand up, without using a hand. So you're not trying to push off the chair. You're trying to use your legs to stand up. So she's going to go up from there. Good, perfect. Big round of applause. Well done. So if I was to make that a bit easier for Marilyn, I might put a pillow underneath her bottom, so then she doesn't have to go down as low, okay? And then if we were to be a bit meaner, again, we could put one foot at the back, which means that back leg has to work a little bit harder as she stands up. So I'll give you a help. So ready? Yeah, it is very low. Up from there, good job, awesome. She's an expert. That's good. So then again, higher level again would be trying it single leg. That's sort of, expert level only, okay? So build up to that one. Then that's all for you, Marilyn. But can we give Marilyn a quick round of applause for helping out? Thank you very much. And just quickly, because I think I'm running, 10 minutes, so I'm flying through it. Right, so fatigue. So quite prevalent, 43 to 60% of people living with CMT experience severe fatigue. Can I get a show of hands? Who finds that fatigue is a bit of an issue? Yeah, so we've got a fair few hands up there. So not as much evidence in this space as to what works and what doesn't, but sleep quality is something that came up a little bit in the literature. So restless leg syndrome, where you can't keep still when you're in bed, you're always needing to move. 18% of all people with CMT. Sleep apnea, so for the snorers in the room, that one is quite common. So where you're snoring away and your partner, no one here snores I'm sure, but your partner might say that you're snoring and then you notice that the breathing stops for a little bit. So they might go and just stop and then start again. And then what happens with that is we don't get into that restorative stage with your sleep. So you're less able to recover. So you're going to not feel as refreshed in the morning when you wake up. So it's an area that probably needs a little bit more research, but speak to your GP about sleep apnea. There's lots of ways that you can treat that. deconditioning, that comes into all the sort of the exercise side of things as well. So when we don't exercise as much and say we get a bit weaker, as everyone does with CMT generally, unless they're doing good strength training, you're going to find things are harder to do. So something that would normally not puff you out too much, if you don't do it because of potentially fear of falling or your strength isn't great, then there's more chance of you struggling with it when you try it again next time. So we can get that slow regression in our conditioning, but it's something that we just need to try and get that regular exercise to try and go back out the other way. So yeah, there is some limited evidence that exercise can be helpful in fatigue. There's the other things that have been mentioned: diet, so making sure we're having good quality food, alcohol consumption, so trying not to drink too much alcohol before bed, because again, you don't get into that nice sort of deeper sleep that helps you feel more refreshed in the morning. Caffeine, pretty obvious. We all know that coffee will tend to affect sleep patterns. And then stress levels as well. So like CMT can be quite overwhelming, having the condition. So it's important to sort of talk about any stresses or feelings of being overwhelmed, so that you're not sort of thinking these things through too much at night and then not getting that good sleep and then having more fatigue the next day. So go to a bit of a summary now. So again, just to reinforce Josh's message, so that targeted moderate intensity progressive exercise can really help to slow and even improve strength decline in CMT. So balance can be trained, so don't just avoid these wobbly situations. Try and get yourself into those situations in a safe, controlled environment, because that's how you make it better. And with your exercise, it has to be consistent. So make sure it's enjoyable. Don't make it be a chore. It's not like, oh God, I've got to do all my exercises now. So try and find out what it is that you like. So it might be that it's going to like a balance class. It might be that it's doing exercises at home, going to a Pilates class. It might be getting your best friend to come over and you do an aerobics workout or something like that. Find something that works for you, because yes, there's some great evidence for exercises that work, but most importantly, it's got to be the stuff that you can do long term, okay? Because no one likes getting out on a cold, wet day in Hobart and doing exercise, but I think if you can find something that you enjoy, that's going to be the first step to finding the right exercise for you. But make sure it's challenging. Don't want it to be too easy, obviously not too challenging to the point where you're getting too fatigued, so you've got to find that right balance. And make yourself accountable. Like, set yourself some goals. Say, all right, I want to exercise 3 times a week for 30 minutes, or might be like the Heart Foundation, 150 minutes a week of moderate intensity exercise. But set yourself some goals, write them down, and then you can really work towards those. And make someone make you be accountable. So get your physio, get your partner, get your GP to ask you, have you done the exercise that you said you wanted to do, okay? Because if you're accountable to someone else, it's a lot harder to say, oh, no, sorry, I haven't done it. Whereas if it's yourself, it's easier to just say, oh, it's a bit wet and cold, I can't really be bothered today. But try and have that accountability. You can also write it down as well, so you might give yourself a tick or something like that. And that's a good way of seeing that progress and seeing that you're getting it all done. And then just a summary of those exercises. So the sit to stand, again, good for the glutes, good for the quads, good for the hammies, and very functional task. We do it however many times a day you're about to do it when you walk out of here. So single leg balance, again, need to get into those situations where you are a little bit wobbly. So try to find opportunities to do that where it's safe. So that's why it's good to have the wall there or a chair in front of you, so that if you do topple a bit, you've got something to steady yourself. The calf raise, so that was the rising up onto the toes. And then we have the toes to nose with the band. So going that way with the band that way.
What if you can't do that one? No, I haven't been able to do that for years.
The toes to nose?
Yeah.
Yep.
That's how they first discovered I had something.
Yeah. Yep. So.
And I still can't do it. I can stand on it, go up, and I can do the other ones.
Yep, the toe rise, like the heel rise one. Yeah, so you can try it, like doing it in standing, sort of that kind of stuff is going to be more challenging. Doing it sitting, and just trying to lift your feet up that way. If you can't do that, you can do it without a band, so you can just try and pull back there. Or you could put a band around and actually help pull with your hands as you try and turn the muscle on and pull it. So you're really thinking, pull my toes up, but your hands might be doing a lot of the moving, but you're still thinking about activating the muscle.
I've done it with the band, but is that working my muscle or just the rubber band in my arms?
Yeah, it depends on how good you are at actually keeping the muscle turning on. But I think just practicing, even if it is without the band, just trying to lift your toes up as far as you can. And even if it doesn't move, even if you're thinking about that contraction, we're still working that pathway from the brain to those muscles. So I suppose it is persistence with that.
The myelinator you had on there previously,
Yep.
is that still, because when I first came out of that CMTAA, it was the myelin wearing off your nerves and so the message isn't getting through. Is that still?
Yeah, so there's different genotypes of CMT, but some people it's the myelin that affects it. So meaning that the nerve impulse is slower transmitting through. So it eventually does do a similar thing. It's basically just slows the nerve impulse getting down there. So, or stops it. And that's when we get the axonal damage. So you start with the myelin damage and then it eventually affects the axon underneath that. So, well, we can regenerate nerves as Josh was saying. So the exercise is the best way to try to regenerate the nerves, but it needs to be consistency and that length of time to get it. So there's no time like the present. So, I'll just quickly flick through this. So just briefly, we do a balance class. So I'm in Back in Motion in Murray Street, so just across from the Waratah Hotel. So we've got some balance classes that are available. If anyone wanted to try it out, I've got some free balance class flyers, so you can come to your first class for free and give it a try. Need an assessment beforehand, so we don't want everyone going straight into it. We just want to see where you're at first, just so that we make sure that you're safe during the balance class. So there's some flyers on the table at the back there. Feel free to grab one if you want. But there is limited spaces, so we only have a maximum of 6 to 8 people in the class. So we don't want too many people, because there's a lot of people I've got to keep an eye on that they're not going to fall over. Okay, so but yeah, if you have any questions, we're about to have the question time. So few references, and yeah, thank you very much, guys.